mode. Okay. So, for all those people who are tuning in later, um, this is the Ontario Nurses for the Environment quarterly meeting. I'm Rob, the chair, and we're going to have our presentation start now. And it's looking into the future by learning from the past, reducing waste in nursing. And we're going to have a discussion featuring Una Ferguson and Brenda Hutton. And then hopefully we'll have lots of people chiming in with their ideas as well. So I'm going to stop sharing. We'll go to gallery mode.
You want me to start, Una?
Either one of us, I don't mind starting.
Well, I'll say a few things, and anybody, if this is very informal, we haven't really practiced or anything, but people can ask questions or make comments. But I'll tell you a little bit about my story. First, just about nursing. My mother was a nurse, and she always talked it up. She graduated in the late 40s from Victoria Hospital School of Nursing, and both my sister and I went there too. And I graduated in 71. It's when I started, it was a 3-year program, but there was a nursing shortage, so they cut it to 2 years. So when I graduated, I didn't really feel all that prepared. The 3-year nurses had a whole year of what did we call it, internship or working with staff nurses. So I remember my first job was in pediatric surgery, and it was kind of stressful. I guess I'd be 20, 21, and had to deal with sometimes some pretty sick children and their families. I do still remember some of those children quite well that I cared for. I remember one little boy who was maybe 4 or 5, and he had cancer and he was dying, and his family brought him. I think they were from out of town, maybe Windsor, but they brought him to London to see if anything could be done. But anyway, one night he was with his grandmother and he quit breathing. And there was no orders about do not resuscitate. So anyway, and I was just this young nurse. Anyway, we had to call a code and we went in the room, and the grandmother left. But none of it, when you looked at the child, you knew it was hopeless. He had a natural death. And none of us, I don't remember that we did compressions or anything. We all just stood looking at each other. And then the surgeon called and said he heard the code being called. So he said to, call it off. So, and then we were all afraid to go out and tell the poor grandmother. And it was a very unpleasant experience, a very sad experience. So that was one thing. I wasn't very prepared. As I said, I graduated in 71. And at that time, it was more task-oriented. I remember working on evenings, and one nurse would be the med nurse and one nurse would be the treatment nurse. And the med nurse, I think we did the IVs and the meds, and the other one did any dressings to be done. And I remember working on, I did go to university. I only worked 1 year and then went to university for 3 years, but worked part-time as I went to university. And I remember being on a summer, I worked on a general surgery ward, and I think there might have been 30 patients, but there must have been like 25 IVs. So I had to but the nurse there had them organized quite well, that they all were full at 3 and should be empty by 11. So anyway, you just kept running around and trying to keep them all on time, and we didn't
not
do
have
too
pumps
bad.
in those days.
No
pumps.
pumps.
So
mostly, I think it was plastic IV bags, but we did have some. Travenol, I remember, was glass, like in that picture.
All of them was glass.
I wore a cap like in that picture, and my hair was like that. So that was a little bit how it was.
But the things that you
Uh.
remember too, I mean, I graduated 1968 and things were quite different. We had just, I think, gotten rid of our final iron lung. I don't know whether any of you have even seen an iron lung, but it was precursors to the ventilators now. And people who had had polio were put into the iron lungs, and you had to take them out once. I think it was once a shift to actually wash them, and if they had soiled themselves, because you couldn't give them a bedpan or anything, and make sure that they were clean in that. But when you took them out, they couldn't breathe, and it was a very, very scary thing. As far as the environment goes, I think in our day, I mean, some of the things I wouldn't want to go back to, like we had no attends, we had all cloth diapers for any age group, and that meant from the time you were born until the time you died, you had cloth. We had everything was washable. You had cotton gowns, you had cotton masks. Even your gloves were able to be autoclaved, and nurses did a lot of autoclaving in those days. You had bottle IVs. They were not horrible at times because they dropped, and then you had glass all over the floor. But you learned to live with them. We had IV systems that weren't all disposable. And the needles, of course, were steel. And one of the jobs you had as a student, well, you had it as a nurse too, was putting the needles through a gauze to check to see if they had any barbs, because if they did, they had to go down and be sharpened. And we had the glass syringes like that. So part of your job too was to wash the syringes, and we had to autoclave them. But when you look at the environmental impact, I don't think we made as much of an environmental impact as they do today. I used to cringe at the amount of waste that we put out every day. I mean, when you think of all the dressing trays that we don't use a lot of, and we throw them in the garbage. And none of it is, I don't think, recyclable. You throw out all of your, like you have paper gowns, you have paper everything. In the States, they even have paper sheets or disposable sheets. And I don't know. I mean, you've got to think that when you're washing this stuff, I mean, you're giving jobs to people. You had to have a laundry that was on 24/7. Would the water be that much more expensive now? The electricity to run it? I don't know. The other thing that I think we did was, well, people didn't live as long. I mean, we didn't keep everybody alive. We didn't have I mean, I was looking at, I've still got my original pharmacology book from 65 to 68, and it's small. Like, it's really small. We didn't have the drugs to keep people alive. And it was sad sometimes because we didn't have the drugs to control pain either. And I can remember to this day, the first patient I watched dying of lung cancer. And I can remember when he screamed for literally 2 weeks, solid, nonstop, screamed. There was no relief. And when he died, there was an absolute silence. And I'll never forget the feeling of that silence. And having the pathologist come up, because we had to go down and see the autopsy, and him standing with the black lung saying, "This is preventable. This man did not need to die. He was 48. And from then on, I don't think anybody in our class really smoked. But, you know, I don't know whether, like, to me, we've got to go back to some of it. I mean, I certainly don't want to go back to steel needles and glass syringes, because that was a lot of work for nurses to have to wash everything at the end of a shift.
And the trays,
all the trays were non-disposable too.
Mhm.
They all had to be cleaned at the end of the shift and sent down to the CSR to be autoclaved, to be brought back up.
And the meal trays had no plastic, everything,
No.
or things you throw away. The juice would be in a cup and
Yeah. Or a glass.
yes, and because I'm visiting
But
somebody
then don't forget, we had kitchens in like we had actual chefs in our kitchens who made all the products. If you wanted extra greens or extra fiber on their trays, you just called down to the chef and he put extra vegetables or whatever he felt would give them fiber onto the trays for their meals.
The bedpans, and they were steel, the
Yeah.
bedpans and kidney
Urinals.
basins.
Urinals, all were steel.
Yeah, sometimes there'd be quite a bit of clatter because you might drop them
If you
too.
dropped them at night, it was not fun. For the people that work nights full time, it was not fun when you drop things, because you woke up the whole floor. But the negative things was the sheets had to be, you didn't have any fitted sheets either. So if the person had soiled the sheets, we had hoppers that you had to rinse them out because you couldn't send them down to the laundry dirty.
We didn't use gloves really a great deal, unless
use
it
them at
might have
all.
been maybe for a
Except for
catheterization, but
sterilization.
just for, yeah, just for general care, like bathing a patient or emptying their urine bag, we didn't use gloves. We had to wash our hands. But when AIDS came, when would that be? That's when universal precautions started, and we had to treat everybody as if they were
But then
infected.
you
And
had the nurses carbolizing the whole unit too. We didn't have the MRSA that they have now.
Mhm.
Like one of your responsibility when you had a patient discharged was to go into the room and you sterilized the whole room. You washed right down to the bed springs with a special, well, it was Dettol usually, but a special solution.
I
So
think the AIDS must have been in the 70s, and people were afraid to go in the room. And well, anyway, after that, they did start the universal precautions treat.
Wasn't AIDS in late 80s?
that's
Well,
the,
Late
maybe
80s
it
and
was.
early 90s?
yeah. Yeah.
And I worked in home care for a while. And one thing we did, and this was in the late 90s, so it wasn't so long ago. All the patients, of course, we did quite a lot of wound care. And in London, they would sterilize their own. We'd put a pot of water and put the forceps and scissors or whatever you were going to use in that and boil it for, I think it was supposed to be 10 minutes. And we also, and sometimes the family would boil it dry and they'd be ruined. And we also made our own saline. Well, we taught the patients to do that so that it wasn't purchased. So that was and the dressing tray was the pot. We'd use the pot as sort of to keep the forceps and
But some
everything.
things were easier, like we had mouth care trays, for instance. I know when I worked at St. Vincent's a long time ago, I actually did my fellowship for ONE-IIOE on improving health or improving dental care. And one of the things that I got told by many people was there are no mouth care trays. And if we don't have them really at the bedside, we have to go looking for equipment to do mouth care. And it would be much easier if we had a mouth care tray. So we tried to get a hold of one and they didn't really have one. So we sort of had to make our own up. But once they were at the mouth care tray was at the bedside, then we found that people actually did mouth care. So it's an easy fix. But
I don't know if we used what did we use for mouth care right at the
you had, well, we had that horrible mouth care solution that they used. I don't even know what it was called, but it was awful. It tasted awful. To me, it was like Listerine on steroids. It was awful stuff. And they put it in the little cup and we used face cloths to wipe out their mouths and whatnot.
And there was something in London we used to prevent bed sores was brown soap.
Oh, brown soap. Yeah, brown soaping was
Mixed with, what was it, just water or alcohol maybe? I forget.
water.
And you rub it on the area. Supposed to.
That was like when they used to use oxygen masks for dressings, because they felt that if you put the oxygen right on the wound, it would heal the wound. And you'd actually tape an oxygen mask to the area and leave it for a certain, whatever the doctor ordered, for how long he wanted it on.
And we still use poultices a bit when I first graduated. Linseed poultice. to put on
Well,
somebody, was it to put on somebody's belly if they had gas, or what was it for? I forget why we used it.
yeah, we had some weird
We
concoctions.
had some pretty old-fashioned treatments.
Yeah, and don't forget, we were before the metric system, so we were in drams and ounces, and all your med cups were glass. And you had little trays that you went around with your med cups, but you also had a booze cart where you went around with liquor, like with wines and stuff for the patients who needed it medicinally. And you would give them a little bit of beer or a little bit of wine or whatever.
Or sherry, they thought that
Yeah.
helped the appetite.
Yeah. But I'm anxious to hear what the younger nurses think of, for instance, cotton gowns and cotton. Like, do you think we could go back to that? I mean, the gloves, I'm not sure, because they were hard to get your right size in the gloves. And they always were thick and they weren't easy to do dressings with. Yeah.
I'm curious where, like, we don't have a lot of laundry systems the same ways. We don't have a lot of food prep systems the same ways.
No,
We've like contracted all this kind of services out in the name of efficiency, but like maybe bringing some of that stuff back in so that you could make it more in-house.
but would it make it more costly? Like, I'm trying to think of the cost of water. Like, if you were doing a whole hospital's water or all their laundry and that, would it be more cost effective? I'm sure it'd be better for the environment, but we all know it's all down to the bottom dollar.
Yeah.
What about the electricity that it would need?
And then how do you make it so that you can weigh it? Because if you take a system that maybe it's slightly more expensive, how do you go to that system? Like, how do you put regulation in place or weightings in place so that it would make it the more chosen option?
And then you have to think, like, right now, I mean, if anybody has any type of infection or whatnot, it goes in special bags and it gets disposed of separately. But with laundry, what do you do with the infected stuff now that we have so many of the infections that can be really systemic to like it can go like wildfire through a system?
But didn't those infections exist before too?
I don't ever, well, we certainly never had MRSA or anything like that. Um,
Or I
I
guess
mean,
you didn't know about them, maybe.
we didn't know about
Yeah.
We
those.
had TB.
Yeah,
We
TB.
had a lot of TB.
TB. Yeah, I
It was
agree.
very contagious or infectious or whatever. In fact, in Ottawa, we had the Royal Ottawa used to be the TB
The
center.
TB. Yeah, I remember that. Yeah,
Mhm.
Well, that's Nancy Brooks.
that's
I
that.
believe she was suggested to be a speaker on this, but she wasn't feeling too well at the time. So I'm glad you joined us, Nancy.
Oh, I couldn't miss it.
Yeah, share some of
In
your
your days,
experience.
did you have all cotton stuff too, or
Oh, yeah, I'm a 1970 grad.
yeah?
So we had all, and I remember actually in the late 70s, they must have started to get stuff because I was working at North York General and I worked evenings and I had to catheterize a woman who was living with hypomania every
Okay.
night. So that was just really some challenge. But I remember getting the tray and looking at it and saying, well, where is the K basin? Where is the, it was like because they had moved it into disposable and it was not the same.
No, and like the products, I mean, granted, I would never want to go back to the old NG tubes that had to be in
Yeah.
ice, put them, and they were horrible to get down anybody. I mean, I thank God every day for the little new ones that we've got that just slip in and go down. Like they're wonderful, they're weighted and everything. But the catheters and that I found, I don't know whether
Is there a way that you could like change how the maybe not change the catheter itself, but change how the catheter is packaged
well, they
and
package everything. That's the thing. I mean, they overpackage everything.
Mhm.
And the thing is, you waste so much because obviously a nurse's time is precious. So you go into a room, you say get your stuff for a shift, and say they die 5 minutes into it. You can't take that stuff anywhere else. You know, you have to throw it all out. Like, or like, you know, you can't.
I see now, a family member's in the hospital, so I'm there quite a bit, that they don't leave even sheets or anything hardly in the
No.
room. So I think they're
Well, I mean,
cognizant.
the wastage must be have been horrendous. I mean, I was thinking of Attends and things like that. But they've got to be convenient. And I mean, Nancy knows in our situation, I mean, you can't leave them outside the room or somebody will steal them. You know, like,
Mhm. Well, they're very handy stuff
yeah, that's
to
right.
have, like to have for home.
Yeah. So, you know, like, but I don't know whether like going back to washing, like I never minded the cloth gowns and the cloth masks. In fact, I find, and they fit a lot better and they didn't, most people weren't allergic to them.
How effective were they? Do you know if they have any studies that compared them?
We were never told.
No,
Like,
I
whether
suppose
effective or not,
they could get wet, but so could the paper
but the
one.
masks get wet. Like the paper masks get wet and they're horrible to have on.
Well, the new ones are like 3 layers of plastic.
Yeah, and I mean, I was allergic to the N95s. That's why I ended up getting out of nursing when I did at 73. But because I couldn't tolerate the testing, I went anaphylactic every time. And I'm convinced it was the actual mask as opposed to the solution, because the first time I got it, I ended up in hospital. But the second time, I just actually turned blue and couldn't breathe. But, you know, I never had any problems with the cloth mask, and I didn't have much. I did have a bit of problem with the paper masks. They sort of itched and whatnot, and I got red. But
So
the
TB is
N95,
airborne, and you dealt with TB a lot in that era.
yeah, really.
So what measures did they do to deal with airborne pathogens in that era, or they just didn't deal with them?
Just get on with it.
And I think my first or early job it was burns and isolation. So they did have private rooms for somebody with some sort of infection.
But also, I mean, I had 16 bedrooms too. So I mean, trying to keep an infection, even a cold, under control in those rooms. Did they ever have those at the Royal, Nancy? The big 16
Well, by the
bedroom?
time I got to Royal, the Royal in 1971, it was psychiatry.
Yeah. No, I just wondered if they had it, like I was at the Kingston site, and like when it first, well, we were the Ontario Hospital School of Nursing,
Mhm.
but we had 16 bedrooms because that's where we learned to make beds by the hour.
Oh, yeah, no, there was, the most was 4. Oh,
Oh, okay.
yeah. Oh, although there was a sunroom at the end of the Whitney building, and it would have had more beds. It might have had 6 or 8,
Yeah, because I know we had
like a
our
dorm
biggest one was
style.
the 16, because they used to shoo the patients out every morning, and we would go in, and as I said, our job was to make every bed imaginable.
Mhm.
But no, our training was a little different.
How did people even sleep in dorms like that? Because not a lot of sick people just don't sleep.
Mhm.
Did
Or
they
they're
sleep?
confused and yelling.
Yeah. Didn't have any choice. Like, if you couldn't pay for another room, you go put where you were put.
Well, and sometimes like the smallest room was a 4-bed room.
Yeah, that's right. Yeah, I can remember that too.
Yeah, so you didn't have any sort of option for a private room, or
No,
they just didn't exist.
no. But I mean, we've been telling them since what, 2003, that they should get rid of the 3 bedrooms and whatnot in nursing homes. And of course, the pandemic
Mhm.
proved us right,
Mhm.
because I mean, you can't keep an infection under control if you've got 3 people in a room. And then they used all cloth curtains too, which were lovely to deal with, especially if somebody was coughing or spitting up.
Mhm.
It was kind of gross.
I think actually, like at the time and whatever, there sort of was no thought really to, I mean, now we think of the material, we think of the environment, the structure, we think of all those things, but I think back then it was just like there was no thought to, and we didn't know as much
No, not at all.
infections and contagion and that kind of thing. So things were definitely not built or created or uh, the decor or whatever. There was no thought in doing it about the possibility of infections and the fact that a cloth curtain really is not a great barrier for things moving from bed to bed. But there was just like it wasn't even on the horizon. It wasn't even
No. considered.
considered.
Not at all. And then
Yeah.
don't forget, the nurses smoked at the desk, the doctors smoked at the desk,
Mhm.
patients smoked. You know,
Mhm.
they had smoke. I can remember as a student being stuck in a smoking room with the patients, and it was blue with smoke,
Mhm.
and we didn't have masks or anything on.
No.
We had to make sure that the patients had burn aprons on, though,
Mhm.
special rubber aprons, so they didn't get burnt when they dropped the cigarettes.
And we had to wear the caps at first too for a while. And they were,
Lovely in the
Dif-
summertime when they wilted.
yeah, and difficult. Like the one I had, you had to take it apart and send it to the laundry and get it starched. And
Chinese laundry, couldn't go to any laundry.
yes, and
Had
then
to
you
be
had to gather it and sew it all up again. Like it was a lot of work. So you wore it for quite a while, sprayed with whatever, and I'm sure it wasn't very clean.
I don't think it was very environmentally friendly
What was the purpose of the caps anyways?
to distinguish you. You could tell, I could go into a hospital and tell you pretty well accurately which hospital they trained at, just from the look of the caps.
Each hospital had a different one.
Yeah.
And they were quite,
Different.
it was fun watching all the
Because the Royal Vic in Montreal had these little, they were like a little teacup on top of your head, and they were all daintily, like they were cute. They were cute little things. There was one in North Bay that I swear to God, they were like the flying nuns. It was so wide. I don't know how they got through doors with them. Ours was a thing that I still have mine. It's a cute little thing that you just sit on the top of your head. What did
Well,
you?
mine was a pillbox with frills, and it looked just
Oh,
like being a French maid.
that's right. Were you?
I used to love to go to the Toronto. We did some of our rotations at Toronto General, and I loved to go to the cafeteria because they had a lot of British nurses,
Oh,
and they
right.
had fabulous caps. I think
Yeah.
the idea with caps was actually for sepsis and whatever. It was they started out so that they covered your hair,
Yeah.
but
Well,
you know,
they were veils.
yeah,
And,
yeah,
and the
yeah.
Brits, I still think, I don't know whether they do now, but up till a few years ago, they still had the veils,
Hmm.
like that they covered their hair.
Oh, some of them were wings. They had big wings, and
Yeah.
they were I just spent all my time gawking
Yeah.
No, I
at the different
remember
cats.
looking as a student, especially, I seeing all the nurses in
We
the
won't
different.
say how many germs they collected.
Yeah, really.
They were just big germ collectors.
Well, and you think that they weren't very convenient for providing care, like
Oh,
some of them
no.
would get in the way.
And they bat them off you. And
Yeah.
yeah, no, it was interesting nursing with caps.
So in the room we have some med-surg nurses, a palliative care nurse, an ICU nurse, and others as well. In our settings, various settings, we produce a lot of waste. Do any people in those settings have any questions about how the care looked back then and how it looks now and how we could learn from back then, maybe things that we've lost that could be beneficial?
I find it always astounds me, like when it comes to the food, how much waste there is on the tray. And
Oh,
then
yeah.
because of infection, like anything that goes in the room gets thrown out. It could be a banana and it gets thrown out. It goes down to the kitchen. I assume it goes out. And I spoke to our nutrition services one time and they said, like they had looked into the idea of composting, but the risk, especially in downtown Toronto, of pests, then they wouldn't be able to have the kitchen, basically. I mean, they didn't come out and say that, but I mean, if
Yeah.
you attract the pests because of the composting, then you're not going to get your little green dining safe pass, and maybe your kitchen will get shut down, and then we've got no food for our patients. So there's all these barriers in place because understandably we need to do infection control. But I'm wondering, like they used to have, like you said, real cutlery. Why can't that go in an autoclave? I don't know. I don't know enough, still learning, but I don't know enough about infection control to say, why can't we have and bring back some of those items? Or why can't we have things like the reusable products, except that as you've pointed out, we don't necessarily all have the capacity to properly sterilize all of that equipment if we were to switch all of our disposables to reusables, to do that all on site. So we would then potentially be creating more carbon footprint by sending it out and bringing it back.
Why wouldn't they have just
Curious.
kept the cleaning kitchen that they had? Like, to me, a dishwasher is a dishwasher. I mean, they have to go under a certain thing to open a restaurant to
Mhm.
maintain that the kitchen is kept clean and the food utensils and whatnot are all
Mhm.
sterilized and whatnot.
Well, I know even St. Joe's in Toronto, it's down by the lake. They have a kitchen on site and they use real cutlery and they use real ceramic plates.
Yeah,
I can't remember what else I was there. It was a year ago since I
and
was
try
there, but
real food. Like, we need real food back.
they don't have as many food options, especially in like very diverse world we live in today. It's harder to get, we can offer kosher meals, vegetarian, we can offer halal, we can do all the different, not all of them, but we try to do more culturally appropriate meals. But I found that at the hospital where the food was made on site, they didn't have that capacity.
Oh, that's likely the biggest reason why we've gone to the airplane food.
And
Oh,
I read in one of the articles that I did that, or maybe it was the course I took through um, the physicians, what's it called? There's CAPE and there's Cane. Anyway, the CAPE course I took, that half the food is wasted in hospital, about half.
yeah, and that's a crime. I mean, there are hungry people in the world. There are hungry people here. Like, why are we wasting all of this food? And
Well,
if
I think some of it is, I just actually spent lunch with a friend whose husband had been in hospital for 3 weeks or whatever. And part of it also is that a lot of the food that gets sent back is just not good. I mean,
oh,
and people who are not well really need to have good, nutritious meals.
yeah, you need to
And
have
they
this
get
food.
stuff that they just don't. But I think that would be a great idea. There's no reason why we couldn't use, stainless steel cutlery.
Yeah,
And maybe also one of the reasons that people have some difficulty with eating and certainly not enjoying it is if they have plastic utensils.
oh God, I hate those.
but that might be, that sounds like a really good idea.
Yeah,
That, and we could wash dishes. I mean, people wash dishes,
yeah.
have actual dishes, and then they have the, those silver things that they put on top, so you don't have, you don't have the plastic and stuff like that. You put the, I don't know what you call those things
Covers,
that,
the
yeah,
covers.
the covers that go on the plate. Um,
And it would keep the food hotter,
mhm,
and it would eliminate the microwave look of the food.
mhm,
And some of it is, I mean, I was on one of the testing things when they went from our fantastic cook in the kitchen and who was making all of our meals, and who actually, I mean, the meals were fantastic. Like, and he made excellent soups and whatnot, and the patients loved the meals. In fact, it was so good that part of the retirement package at one point was you got free meals for the rest of your life. You got one free
mm.
meal for the rest of your life.
The staff.
Yeah, the staff. And and everybody loved it. And then they went to what I called the airplane meals, and I tasted them. And like, fortunately, I was working with the elderly, and we had a lot of. They were trying to find things that would go with the minced meals and whatnot. And I said, like it. They brought in pureed spaghetti.
Why bother?
And that's exactly what I said. I said, that is disgusting to look at. I wouldn't even put my fork into it. And I said, you don't expect me to feed it to anybody. Like, if I won't eat it, I don't want anybody else eating it either. But, you know, some of the solutions are simple. Like, why couldn't we go back to having a chef that just made soups, for instance? Soups do wonders. They found that for years.
I feel that I derailed our conversation from nursing to our food crisis. But maybe can I just ask if
Part
there
of
was,
the nursing. Oh, we have to
It's part
talk.
of it's
Yeah,
part of it's
it is,
part of
yeah.
getting better and rehabilitating.
But
Yeah.
I'm just wondering,
Mhm.
like, from our 3 nurses that have been through a few decades of care, if there was one medical item that you could bring back that you think would make an impact, what would it be?
I would bring
Because
back
you've
the
seen the
trays.
transition, so if you could go back to any one item.
I'd say bring back the trays. Not the like the non-disposable dressing trays, catheter trays, any other type of trays. I think bring them back and have them autoclaved, because to me it's such half the time you opened up a dressing tray, the gloves either ripped or something happened while you were opening it, and it's just a disaster. Whereas the non-disposable trays were sturdy. You could open them up. You brought your gloves in, and they were in a sterile environment. I don't think even at the end we had little plastic gloves in there because they didn't come around for ages. But it was just easier to use, and you weren't throwing everything out. Like, I've opened dressing trays and I've used maybe 2 items in the whole thing and threw the rest out. And you think if you do that, say 3 times a shift or 4 times a shift for 10 people, that's a lot of waste. I wouldn't want to even think of how much waste they have.
I was listening to the radio today, and there's the plastics conference that is just wrapping up here in Ottawa.
Mhm.
And uh, the head of the CHIO, the Children's Hospital in Ottawa, the green head of the green team is Dr. Curtis Lavoie, and he was on the radio for a little quick section talking about how much plastic they use in an ER. So like a little infant comes in with they want to screen for a UTI or whatever, they go through a ton of plastic to do a little quick in and out catheter to get a urine sample.
Well, you just think of, I mean, if you watch the ones that I watch are the paramedics. I mean, granted, it's not nursing per se, but have you ever seen them when they come in to do a patient in house? I mean, they leave a pile of plastic in your house because they've opened up uh, their IV tray, they've opened up umpteen dozen pairs of gloves, they've had this, and it all gets left on the floor, and it's either paper waste or plastic waste whatever. And I think if they're doing that all the time, and nurses are doing that all the time, I wouldn't even, it would be tons of stuff that we're throwing out.
Well, when you think about it, you can really understand when they say that healthcare is what, 30% or something of the whatever it is of the overall
Waste.
waste and whatever. You can really you know, at first you don't think about it, but then you sort of, when you think about it, it's, and I also wonder whether all of these new hospitals, like the Ottawa hospital that is going to be remade uh, or created, and they just did Montreal. And I just wonder whether in those facilities, they would even have such a thing as autoclaving or the wherewithal to actually create um, non-plastic stuff, you know, to rewash or whatever the stuff.
don't
Like
think they
I
even
think
think
they
that way.
probably don't even have.
I don't think they think that way.
Well, they'll
No.
have some of it because the ORs do reuse some things,
Mm-hmm.
but it'll be the capacity level will be a magnitude less than is needed to change it from that to that.
Mm-hmm.
Well, what scares me is that we'll go American and we'll start getting disposable sheets, and we'll start get like some of their private
They have
hospitals,
disposable sheets?
they have disposable sheets.
Yuck.
What are they made of?
God knows. But anyway, they have those, so.
I'm curious from our ICU nurse. I'm sure there's got to be an ICU related question.
Oh yeah, well I'm just thinking about everything. Yeah, I'm surprised to hear how much stuff was autoclaved. And I was like, wow, like that could reduce so much waste that we use today. Like from central line trays, dressing trays, catheters, like even like putting intubating someone, like there's like so much waste. And even like our trays. So surprisingly, yes, well, our trays are actually like food trays. Sorry, it's really loud. I'm gonna close this window. Kid, you gotta get down, buddy. There you go. So our food trays, we have like ceramic plates and we have like stainless steel ware, but I'm surprised to hear the other hospitals don't. Like you guys have plastic and like disposable one-time use. So I thought like it was normal for us to have like the stainless steel and everything. So I'm glad we have that. I've recently switched from styrofoam cups to paper cups, which is kind of nice, but there's still like so much work to do. And I think like, I'm just thinking, yeah, like from all the IV bags we use, like all the drips that patients are on, to like, yeah, even the IVs and everything. Like, I know I'm trying to think from an ICU standpoint, like,
How much of that would have even existed though back
Mm.
50 years ago?
yeah, like it's not like I
None
don't
of
know
it.
if
You
you guys
wouldn't
had pressers, like you didn't have like life-saving meds really, right? You didn't have
you
any.
didn't have any of that. You didn't
I
have
don't think
lots-
they might have had intensive cares just when I was starting, but like 10 years before, I don't think there was such a
But I
thing.
mean, intensive care wasn't intensive care, like you didn't have the machines running, keeping people alive. Like you do now.
Oh, yes, they did.
Did they?
I can just say that because I remember I had to consult
Ah,
on neuro ICU,
okay.
and like the beeping, the patient was very disturbed because there was beeping saying, see to me, and the nurses were ignoring it, and I was getting anxious. Like, I did not really enjoy that particular part of my job when I had to do that, but they certainly had, um, you know, all sorts of things. And, you know, like in the very early 70s, like in 71, I worked on orthopedic surgery,
Right.
and none of those people who underwent Harrington rods and whatever had pain because we had medication that we gave them so that they, like, it was narcotics, but
Yeah.
for sure there was not rampant pain around and whatever. They were well medicated so that they could be comfortable with their rods in and all that kind of stuff. So, but certainly the ICUs, I was not keen on those. They were scary.
I don't remember ever even being in one when I was a student, like, or even knowing about them. We
Mm.
saw the OR, but I don't ever remember being in an ICU in 68. Maybe there would likely have been, maybe in some of the bigger hospitals, but
It's interesting.
Well, I was in Toronto.
yeah, you were in a,
Mhm.
yeah, we weren't.
When
We-
I worked
yeah,
casual, we had to go anywhere in the hospital. It could be ICU or it could be, they wouldn't give me a ventilated patient. It would be one of the better patients or healthier patients,
Well,
less
as I said,
ill.
we just well, we were
Or
just
I-
getting rid of
the
the iron lung.
Newborn nursery or anywhere. Yeah.
We definitely took care of iron lungs
No, I didn't
patients
remember that.
of those.
Yeah, that's wow. Yeah, the iron lung. Oh my gosh.
They
I
were
can't
so
believe that. I
scary.
can't believe you'd have to like take them out and like like when you took them out though, because that's like going off the ventilator. Like how long did you have before you needed to put them back
Did
in?
very quick bed baths.
Like super
we had-
quick.
So very quick and very, like, we usually had two people doing it,
Yeah.
and we did it like as quickly as possible, and you had to have them dry because they wouldn't be touched till the next shift.
Wow. So just once a shift, they would just get clean and then back in the iron lung.
Yeah.
Wow. Wow.
And I can remember trying to keep, the hard part was trying to keep them amused because they couldn't
Yeah.
get out of the iron lung, so they were lying flat. So
Oh.
some of them wanted to read, and we had to figure out devices so that they could read a book.
Yeah, you're just laying there all day. Yeah. Oh my goodness.
Yeah.
Wow.
As I said, for people that don't like to vaccinate their kids for polio, they had to see that.
Yeah.
I watched a lot of kids die of polio.
How was it the air going in and out that,
It was a machine that basically, I think it was like it was a pressure, constant pressure
Yeah.
off and
it
on.
pressed on something pressed on their chest?
Yeah, it was how the machines was, like, the machine actually moved inside, like you couldn't see anything moving, but whatever it was doing, it was making them breathe.
What
So-
was the
It was
quality
sorta
of
like
life like on an
CPR.
iron lung?
Yeah.
Pardon?
What was the quality of life like with an iron lung? And
Terrible.
how long
Absolutely
did they
terrible.
were they
Oh, they
receiving that
died.
treatment? Was it for the rest of their lives?
Yeah, they couldn't come off of it. They couldn't
Oh,
breathe.
wow.
They never recovered.
Some people get better or not?
I never saw anybody get better.
Jeez. Oh my God. So it was like inevitable. Like it was like you're just there until you pass. Wow.
And we were always scared to take them out because
Yeah.
we took them out too long. I mean, they couldn't breathe. It
Mhm.
was
Yeah.
scary.
How long would it take for them to pass away with
Well,
life
they
in
were,
an iron lung?
unless they got an infection or something. They could be there for quite a long time.
Bed sores?
Oh, yeah, we had to watch those. And we had some, as I think Brenda was saying, we had some nifty ideas on how to cure bed sores. The brown soap was, if you ever had, I don't know whether your grandmothers would have ever had the brown soap in her wash basin to do the dirty laundry. It was a sort of a lye type soap. It was a
Big bar.
big bar of
brown.
brown soap. Anyway, and what the idea was, you would put it on and you would leave the soap on, and it was supposed to help the skin. You didn't wash it off, and it was to toughen up the skin so it wouldn't break down.
Oh wow. And we just like slap on barrier cream and
Yeah, that's right.
and we're like calling it a day. All right, here you go.
Yeah, we had to.
Some pillows. Yeah.
Oh, it's like when we did evening care. I mean, you went around with a trolley, and you had your towels and whatnot, and you gave them a full back rub, and basically an upper bed bath, and everybody got one every night.
Yeah, that's what we do in ICU. Everyone gets bathed every single night. Yeah, we do a full thing. Yeah, but it's very different now than it was back then. Yeah.
But I can remember as a student we were on a 22-bed floor, and there was 2 students and 1 RN.
Wow. Wow. Oh my gosh, can't imagine managing that.
And that was on a med surge.
I have a question. Sarah, you work in a hospice. what kind of questions from your practice do you think would you like to ask that have changed in the last 50 years and could be a learning opportunity in your practice?
One thing that I find is that we're really stuck on using straws for people to drink out of a plastic cup with a lid. And it's so ingrained that the staff think that people need a straw instead of just being able to sip out of a cup. That is one thing that I'm always kind of
I don't
thinking
know.
about how to educate around that. Like, what, you don't need a straw. It's such a gigantic waste,
Well, and wouldn't it also make you sort of feel like, because probably at home, they don't use straws. I mean, I don't use straws at home. I
No.
just only ever if I happen to, well, I don't even at a restaurant or anything. But like to drink out of a glass is kind of like a normal thing to do.
Yeah.
And so you'd sort of think that if you had to drink out of a straw, that must mean I'm not as good as I thought I was because I have to have a straw.
Or either, I always found when if they were needing hospice care or whatever, we used the little medicine cups and just gave them a little bit often. And you could I've given a person almost a liter that way. Just going in every time you sort of pass the room, you just go in and give them a little bit of water. And it worked. A lot of people lose the ability to suck, like through a straw. I would think, unless if they were asking for a straw, I wouldn't even consider a straw.
Yeah, we actually like with stroke patients, we like discourage using straws because they can't really wrap their lips around it properly, and then they actually are like more risk for aspiration. So we just like it's actually better just to like sip it too. It's interesting, but it's like we always just like naturally are like, oh, here's a straw, and like here's a brand new cup, and it's like yeah, because you can't like go back with their dirty cup and refill it at the clean stations. You have to throw it out, get a new cup. And it's like just that's all. Yeah, it's very very wasteful. Yeah.
The other thing too is that you find that like not only the use of straws, but the use of we had those horrible little paper cups. I always found them kind of useless too, because we put anything in other than water, they disintegrated on you. I remember trying to put mouthwash in them one time. That was a mistake. But I always found that I hate to say the little plastic cups are, well, in my day, we actually had glass cups, which also you had to watch because they could get splinters and whatnot. And you really had to watch that they hadn't chipped or anything. But I don't see why we couldn't go back to those either. The little medicine cups that were glass.
Yeah, yeah.
Even just those little cups that you get at the restaurants for your dips, the metal ones.
Yeah.
Yeah,
A
yeah.
whole whack load of those.
Yeah, see, we could just
And they could be cleaned and sterilized.
exactly like so
And they
many
could very easily have a little, 15 mil, 30 mil.
easy.
Yeah, just a matter of lining it. One of you should discover that and you'd make millions.
We're gonna move on to the business portion in just a moment, but from any of the other people who are attending tonight, are there any other questions before we move on to the business section? Anyone? Joanna, I saw you unmuted yourself. Was there anything?
No, I was just thinking, I did my training in the Netherlands and we did have these metal medicine cups and whatnot. And the other thing I was thinking of is, yes, the enormous waste when people are in isolation. And that has always been a pet peeve of me. And I can see it, how people bring stuff in the room, because once you're there, and especially on isolation, when you're all dressed up, having worked in a burn unit, if you're missing something, nobody's going to come and bring it to you. But yet, it's also the mindset of people to sort of be cognizant and take ownership and say, because as people are saying, all that stuff gets thrown out, and it still happens to this day. I've had loved ones in the hospital recently in the last year, and lots of stuff, expensive stuff gets just thrown out because they bring in umpteen. And it's, yeah, I think it's also a mindful of some things we can get around, but we also have to be mindful of waste to at least eliminate it as much as we can.
I think too, what we forget that, like I once at one point suggested that they give especially the dressing trays and whatnot to a bird sanctuary. And, use them because most of their stuff is clean as opposed to sterile. And I thought, why couldn't we just bring it all over to the bird sanctuary or one of the pet clinics or whatever, and give it to them? At least then it's used twice before it all goes into the landfill. But no way. Once it seems to be deemed unsuitable, it doesn't get used again.
Well, I think there's been a lot of good discussion here, and hopefully it's created some ideas for some people to take action where we can. Um, I'd like to thank Una and Brenda for presenting, and Nancy for chiming in a lot, and Joanna for your question, and everybody else for showing up as well. We're gonna,
Rob, I just
Yeah.
want to say one thing before we end this, and people were talking about the model of nursing care delivery in the early 70s and what have you. And I just have to say, just because we are an RNAO sub-interest group and whatever, that after I graduated, I worked at the Civic on orthopedic surgery for in 70 and 71. And exactly at that time, the RNAO was doing one of the, they didn't call it a pilot project, I forget the word for it, but they were actually implementing team nursing.
Mm-hmm.
And so we were part of this project and they were like studying it or whatever. And of course, then through my career, we moved into primary nursing and to person-centered nursing and whatever, far away from that. But actually there was I just forget what they called that particular project or whatever, but that went on and was studied and whatever about team nursing. And so that was, yes, because I can remember like we had team leaders and all that kind of stuff that was like brand new, and it was just being a pilot project to implement it at the Civic Hospital in Ottawa.
Was it good?
1970 and 70 to 72, I think it went. So I just wanted to just sort of say we were way back then at least trying a nursing care delivery model at the time, which of
Did it
course
work
now.
well though? Did it work well?
Well, it seemed to.
Yeah, I enjoyed team nursing.
Yeah, because it was because then it became kind of like
work together.
Yeah, and it became what facilities used. They had, before they implemented primary nursing, it was team nursing was the model that went on for, maybe 10 years until they started with primary nursing. So it was successful, and you could still see remnants of it from place to place and from time to time. But yeah, working together and working as a team and all that kind of stuff.
I think it gave us our nursing voice.
At the time, yeah, I think at the time it was truly very innovative, and nobody had done it, and they had developed the whole description of what the different
Well, they didn't see nurses as leaders. I think what the team leader was, but I don't think that in the past they had really considered nurses as leaders. Like,
You know, so
I'm
just
aware-
even the name
yeah.
was, mhm.
So a team nurse leader was just something really, like, maybe she had some intelligence, you know? Which
Anyway,
you
I
laugh
just
at,
did
but I
want to
mean,
say that particularly at the Civic Hospital was one of the sites that in the very early 70s that was a pilot project or whatever they called that for team nursing. And at the time it was new and it was unheard of.
mhm. I mean, don't forget, we lived in an age, I mean, I certainly did, I'm sure Brenda and Nancy did too, where when I went in training in 65, you got up when the doctor walked in the room. You gave him
Oh yeah.
anything that he wanted. Like if he wanted to take a chart to another floor, you literally had to go to the other floor and get it from him when he was finished. And he just basically ruled the roost. We had to actually move out of the way when they were walking down the stairs. If you were walking down the stairs, you moved out of the way so he could walk first. And so nurses didn't have a lot of say.
Things have changed.
Things have changed, and I'm so glad.
Mhm.
Yeah, there's,
I mean, we were seen as handmaidens.
and just doing tasks, not really.
Yeah, we weren't supposed to think about anything or challenge anything.
And that's where the primary care nursing does come in because you're supposed to be thinking about it. I
Mhm.
wonder if there's a way of like combining it, but we do have to move on to the business
Yes.
portion.
Yeah.
We're just
Um,
adding a little history.
I think it's great, and that's what tonight's about. So, and you can't move forward into the future. And right now, with my organization, there's a whole bunch of people. There's been a huge transition, and they've had to go back, and there's been huge productivity losses, and they're reinventing the wheel, and they're doing the same thing that they did 5 years ago.
Yep.
So there's a value in learning what happened a few decades ago and where can we pull the good stuff from and bring it forward without, well, bringing also the new stuff. So where can we combine
Mhm.
it? So I think this has been excellent. I think, but we do have to move on. Thanks again to all of our speakers and all the people who've contributed. I'm gonna stop the recording now